If you're wondering if your migraine or headache medication might be interfering with your weight loss efforts, I have some information for you. So let's get started. Thank you for joining me today. My name is Dr. Meghan. I am a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this channel is a one-stop shop for matters related to evidence-based matters related to weight medicine. So thank you so much for joining me today. We are going to talk about headache medications, migraine medications, and if they might be interfering with your efforts to lose weight. And again, when we are talking about weight loss, this video is for people who are interested in losing weight for their health. Doesn't apply to everybody, but this video is for those people. So let's get started. So let's start first with medications that are not going to interfere with your weight loss efforts. And those are things like abortive medications like triptans. So rizatriptan, sumatriptan, frovatriptan. There are like literally so many different triptans. If you are on one, you should be feeling pretty confident that this is not going to interfere with your weight loss efforts. Similarly, the CGRP antagonists such as Ubrelvy, those really shouldn't be interfering with weight loss efforts either. If you get Botox for your migraines, you should be fine with that. Similarly, any kind of NSAID, ibuprofen, diclofenac, meloxicam, all those really shouldn't be affecting your weight whatsoever. And then things like Topamax, which can be used for migraines, can be used for seizures, that actually helps people lose a little bit of weight. So again, that's a place where you don't really have to worry about that sabotaging your weight loss efforts. What about the medications that could? Again, this is all very patient dependent, but good to take a look and see if you're on any of these medications, because that's a good place to start in terms of looking at where other things may be influencing your current weight if you are looking to lower your BMI. So things that could interfere are things like amitriptyline, gabapentin, that's a big one, SSRIs. So sometimes people are on SSRIs for migraines. Paxil, not a great one. I do have some patients that have been on Paxil for a long time. They really like it, doesn't impact their weight, but I would say overall, I don't love that one in terms of what it does for people's BMI. And then there are some beta blockers actually, certainly for prophylactic treatment for migraines. Beta blockers can be a good approach, and sometimes some of the older beta blockers aren't a great fit or can cause a little bit of weight gain. So that's something to look out for. Also things like Depakote, also known as valproic acid, that can certainly cause weight gain as well. So if you're on any of these, do not stop them cold turkey, but it is helpful to be able to have a list of possible culprits, so you can have this discussion with your physician. Do you need these? If there's one on your list, do you need to be on it? And if you do, maybe there's room for a dose adjustment. Maybe there are some alternatives that you can try. And then in some cases, if somebody's on a medication that's going to impact their weight, but otherwise the medication works really well for them, that's sometimes when I'll talk to them about adding a weight reducing medication like Wegovy to bring down their BMI if we're really worried about medication related weight gain that's occurred. Sometimes that's a helpful tool to have. Again, it's not for everybody, but for some people it can be really impactful. So I hope this was helpful for you today. Thank you so much for watching. As always, my references will be listed down below, and please be well.